Good morning and welcome to our weekly COVID-19 media briefing. I'm Kerri Schuette, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start with our numbers. As of yesterday, we had 11,488 confirmed cases, including 25 from Sunday and Monday. We have 7 people who are hospitalized, including 2 who are in the intensive care unit. We've done a total of 182,776 tests. Our available regional ICU capacity has now sits at 33.6%. And as a reminder, that is capacity in the Northern California region, which includes, I believe, 11 counties. We have had 208 deaths of Shasta County residents from COVID-19. With us today, we have Robin Schurig, the Director of the Health and Human Services Agency's Public Health Branch, and Dr. Kerri Ramstrom, she's the County Health Officer. We also have Dean Germano from Shasta Community Health Center and Mark Mitchelson from Shasta Regional Medical Center. Thank you to all 4 of you for being here with us today. Robin, would you like to start us out?
Sure thing. Good morning. Thank you. I'll go over our latest blueprint data and tier assignment, along with some new guidance that has come out from the state for various types of activities. And I'll touch on the announcement the governor made yesterday about what the state had previously been calling the green phase and that they're now referring to as beyond the blueprint. So last week, I talked about the fact that our case rate had increased, but that it was still low enough that it had stayed at the same level or even increased a little bit, we could qualify for the orange tier soon. However, this week our case rate increased again from 5.1 daily cases per 100,000 population last week to 7.4 this week, which is a 45% increase. Our test positivity increased as well from 1.8% last week to 2.7% this week. So even though the state changed the tier thresholds, because statewide we hit the 4 million mark yesterday for vaccines administered in the hardest hit areas of the state, we still do not meet the criteria for the orange tier. So instead of needing a case rate of less than 4 to move to the orange, we only need a case rate of less than 6 to move into the orange now, and test positivity needs to be less than 5%. We need to meet both criteria for 2 weeks in a row before we could move. On the other hand, if our case rate goes above 10 and stays there for 2 weeks, we could be back in the purple. And then we would have to stay in the purple for at least 3 weeks before we could move back to the red. So it's important to remember that this is not the time to let our guard down, and we really need to continue masking, distancing, getting tested, and getting vaccinated. And at the same time, the state is also starting to open things up, which is good and necessary, but it will hopefully not work against us and land us back in the purple and back to having a lot of people getting sick, some of them being hospitalized and some of them dying. So on the state guidance, the state recently opened travel up from the previous 120-mile limitation to now it's anywhere within the state. They don't want people traveling outside the state for non-essential reasons because of concern about variants being brought into the state. However, they also made an additional update to say that fully vaccinated people, while still encouraged to keep their travel within the state, do not have to quarantine after travel outside the state as long as they don't have symptoms. So those were 2 changes that were made late last week. Also late last week, a revised tier sector chart was released stating that gatherings, private events or meetings, such as receptions or conferences, and indoor live events or performances will be allowed beginning April 15th with modifications based on the tier the county is in where the event is being held. And the guidance that came out the previous week for outdoor seated live events and performances went into effect April 1st. They've also updated some guidance and incorporated into much of this new guidance options for certain things to be allowed indoors or at increased capacity if everyone attending shows proof of either full vaccination or a recent negative test. And then the big news is that yesterday, the governor announced that what the state had previously been referring to as the green phase is now called beyond the blueprint, that it won't go into effect until June 15th, and then only if 2 criteria are met. Vaccine supply needs to be sufficient for the 16 and older population, and COVID hospitalization rates need to remain low. And what it would mean is that the blueprint, so the tier system, would be retired or lifted, and guidance for large, high-risk events would remain in place, as well as masking, but that businesses would go back to their normal, which would include any additional requirements that are still in place from OSHA or from within their industry, but there would no longer be state-level public health restrictions on businesses. That's about the extent of the detail that they've released so far on what exactly that would look like, so that's all we know at this moment. So again, we've come a long way, and we're at a point now where we can clearly see the light at the end of the tunnel, and we need people to continue masking and distancing, and we need people to get vaccinated so we can get out of the tunnel. That's all I have, and I'll turn it over to Dr. Ramstrom.
Good morning, everybody. So just a brief update on what's going on with vaccination right now. We're continuing to encourage our community members to consider vaccination as this is really our pathway out of this pandemic and to getting even more so back to normal in the direction that Robin just described. This includes people who've had a past history of COVID-19. The vaccination helps to boost your immunity. And so in the event that we do have any of the variant strains circulating in our community, that you would have additional protection against those. And if immunity wanes over time from natural infection, you would be protected. So please consider getting vaccinated, even if you've had a past infection. In terms of eligibility, this week we opened up eligibility countywide to individuals 16 and older. And so it's much easier to understand now of who can go. And so have a lot of options for clinics listed at Shasta Ready. In addition, we have plenty of appointments and increasing supply, which is great news. Many of our local pharmacies are also starting to receive federal supply of vaccine. And so most recently we've heard about Walmart and Costco. Either they have it or will soon and are making appointments available. So check those out. And again, lots of information at Shasta Ready on where you can access vaccinations. So I'm happy to address any questions.
All right, thanks, Dr. Ramstrom. Dean or Mark, do you have anything to share this morning before we go into media questions? No, from Mark. Yes, from Dean. Hey.
For me, just that here at the health center, we're about to start receiving federal vaccine, hopefully starting next week. And we're now turning our attention internally to our own patient population more directly. So we hope to really scale up there and ramp up. We've been doing a lot of efforts out there in the field with our patients experiencing homelessness, and we continue with that effort and amongst other things. So we're getting in more into the game, which we need to do.
All right, thank you, Dean. I think we are ready for media questions.
Good morning. I know I passed this question on to Kerri yesterday. I was just going to ask for an update on the number vaccinated. I'm sorry, I did not catch that number vaccinated in Shasta County thus far, if you have that number. And I understand that Reading Rancheria is maybe keeping it, maybe having a different tally. So I was going to ask if you have either of those numbers available at this time, as to how many have been vaccinated in Shasta County and how many Rancheria vaccinated in addition.
Yes, we have 59,261 residents who have gotten at least one dose and 21,506 who are fully vaccinated. We do know that that's a bit of an undercount because there are a few providers who have not, that we don't have their complete data yet. We're working on that. We're in close partnership with all of the folks who are providing vaccine, and there can be a delay in data entry as well. But those are the numbers that we have right now.
Thank you so much.
We've had kind of an uptick in cases in Shasta County. How prepared do you think the county is to move toward this beyond the blueprint stage?
That's a good question. We've been talking a lot about what has caused our numbers to go up these past few weeks, and I think it really is just people sort of getting tired of the blueprint, the blueprint and the COVID restrictions, and so you're seeing a lot more people going out and getting together and not wearing masks and things like that. So there is a lot of COVID fatigue going on out there, and so if that continues as more and more things open up, I think what the result is going to be that our cases will continue to increase as well. So again, we're really encouraging people to stay vigilant and hold on a little bit longer until we can get more of the population vaccinated so that we're more protected.
Do you think the county is ready to move into that stage then? Were people going to have to do something to, are we heading in the right direction or the wrong direction? Where are we?
Well, I'm hopeful that we will be ready by the time that June 15th date rolls around, but basically it's happening whether we like it or not. The whole state is going to move together into beyond the blueprint. It's not going to go county by county, so it's coming, and I think, we need to get prepared for it.
Oh, okay, thank you. I didn't realize it wasn't county specific. With more of the vaccination clinics opening up in private companies, pharmacies, and all that, do you see the large clinics at like Shasta College going away now?
So not quite yet. We have a large population that we want to reach with vaccine, and so in order to do that, we need these bigger clinics, and we want to do it as quickly as possible because we know that these variants are on the rise in our state. The West Coast variants account for is over 50%, I think closer to 60% now of the cases that have been sequenced in the state. And so we want to make sure that we protect our community and prevent those variants from taking hold here. And so now is the time. And so we want to get as many doses in available as quickly as possible. So having those larger clinics, we're hoping will help accomplish that.
Thank you.
I think we also have the need for the second doses too, right?
All right, other media questions? We have a small crew with us today. We do have some questions from the public. One of them was already addressed with the number of people who have been vaccinated. This one is for Robin. Can we assume that many of the unvaccinated portion of the population are now people who are voluntarily deciding, at least for now, to not be vaccinated?
Yeah, so in Shasta County, 37,755 people are partially vaccinated. In addition to that, 21,506 who are fully vaccinated. So hopefully most, if not all, of those who've received one dose of a 2-dose series will receive their second dose. We also know that some people do not wish to be vaccinated, and we know that some still have questions, which is okay. We just opened to ages 16 to 64 in the past week, so it will be a while before we know how many people in that age group are interested in vaccine. And also, until very recently, supply was very limited. So we believe that there are some people who tried to get an appointment and couldn't at the time, and they might not know that we have a healthy supply now. So again, we do have a lot of availability now and plenty of vacant appointments. We're continuing to do outreach to our hard to reach populations to make sure everyone is aware of the options. And we're having clinics in various parts of the county to make sure that vaccine is as accessible as possible. We've also been encouraging folks to check in with their elderly friends, neighbors, and family members to see if they need help either enrolling or getting to a clinic.
All right, thank you, Robin. And I'm going to ask you this one too. Are you collecting data on the vaccination status of all people who are now tested for COVID?
So in California, the state testing sites do ask people if they have been vaccinated. So that data is starting to be collected. The state has not yet made that data available to us. And we don't know whether other places that test are collecting that information. We do ask people who test positive, so cases that are reported to us, whether they've been either partially or fully vaccinated, as well as the timing of when they were vaccinated. And the purpose of that is to send appropriate specimens to the state lab to be sequenced to determine whether they've potentially been infected with a variant strain.
All right, thank you. This one is for Mark Mitchelson. How exactly are patients on a hospital discharge and heading to another skilled nursing facility, rehab, or long-term care being given the experimental injection of CV-19 shot when their immune system at the very lowest for such an inoculation? If patient is too medicated or incoherent, who is making this crucial medical decision? What is the precise and detailed protocol for this hospital discharge shot of a gene therapy product? If you need me to repeat any of those, I'd be happy to do that.
No, it's fine. So really, it's a good question in the sense that it is kind of the next step in the hospital for how do we dispense the vaccine correctly. And what you'll probably see is we don't have it built yet, but it's going to be very similar to what we do currently with discharging people with the flu shot or the pneumovax shot. It's going to be the exact same kind of process. We have pre-printed consents that are made by the manufacturer, trying to make sure that everybody who gets the injection is fully informed. And anybody who's not fully aware of the injection and can't consent correctly won't be given the vaccine. You know, we have to make sure that we don't do anything against the patient's wishes. So really, I think you'll see it go directly to like any other vaccine, and in this consent like we do on discharge. And we do that very routinely.
Thank you very much. Dr. Ramstrom, on March 4th, 2021, there is a CDC 3-page document spelling out death. What is the local HHSA public health explanation today? This was brought in yesterday's Board of Supervisors meeting as the summary of safety data, page 2 stating, quote, although few people in the clinical trials went to the hospital or died, data suggests that people who got the Pfizer BioNTech vaccine, ... end quote.
Yeah, so if you read that full sentence, it says, although few people in the clinical trials went to the hospital or died, data suggests that people who got the Pfizer BioNTech vaccine were less likely to have these more serious outcomes compared to people who got the saline placebo. And so that's the purpose of the vaccine, right, is to prevent symptomatic COVID-19, to prevent severe illness and prevent hospitalization and death due to those due to that illness. So as mentioned in, previously, a small number of people in the trials did die, both with placebo or with the vaccine, but none were determined to have died as a result of receiving the vaccine. So in a vaccine trial, you want to make sure that you have a vast array of people, including older adults and individuals that have underlying health conditions. And so that makes them, have the potential to die of those pre-existing conditions. Like people who receive the placebo, though, those who receive the vaccine then die of those other conditions that that are represented across the trial in the participants.
All right, thank you. And then the last question is, include also an explanation of how those getting a double dose of vaccine then got a COVID infection. The data is all over the place and frustrating.
So this is for me too. Okay. All COVID-19 vaccines available in the United States have been shown to be highly effective at preventing COVID-19. In fact, pleasingly highly effective. And so that's really to our benefit. All COVID-19 vaccines that are in development are being carefully evaluated in clinical trials and will be authorized or approved only if they make it substantially less likely to acquire COVID-19. Based on what we know about vaccines for other diseases and early data from clinical trials, experts believe that getting a COVID-19 vaccine may also keep you from getting seriously ill, that we're continuing to learn that we need more time for people to experience illness to measure that more comprehensively. Getting vaccinated yourself may also protect people around you, particularly those at increased risk for severe illness. A recent study of both of the mRNA vaccines used in the real world, so post-release, so not in the clinical trials, indicates that 90% effectiveness for fully vaccinated people and 80% effectiveness for partially vaccinated individuals, which is very reassuring. That study involved healthcare personnel, first responders, and other types of frontline essential workers.
All right, thank you very much. That was the last of the public questions. Do we have any other questions from Mike or Jessica?
I'm good, thank you.
All right.
Me too. Thank you so much.
All right, awesome, fantastic. Thanks, you guys. We will see you all again next week. Everyone stay safe and healthy.